Imagine living on the island of Borneo about 31,000 years ago. No hospitals, no modern surgeons, no operating rooms, no antibiotics, no x-rays. In your small hunter-gatherer community, a child has a serious problem with one leg. We don't know exactly what happened. An accident while climbing? An injury from hitting a rock? Or some other cause that left behind no evidence to tell us what happened? Eventually, the lower part of that child's left leg was no longer there. The only thing that remained, tens of thousands of years later, was the surviving bone itself, silent, waiting for someone patient enough to read the story hidden within it. Your first reaction would probably be exactly the same as the archaeologists when they first saw this skeleton. A wild animal must have bitten it off. Or perhaps that part of the bone simply decayed and disappeared over time after the person died. Something perfectly normal for remains that are tens of thousands of years old. But after examining it carefully, the researchers reached a completely different conclusion. The cut on the leg bone showed features consistent with a deliberate amputation. Not tooth marks from any predator, and not the kind of damage that occurs after death. Someone, at some point, had deliberately removed that part of the leg from the body of a living child. If the story ended here, you'd probably already have enough reason to be amazed. But you'd also have every reason to think, surely that child couldn't have survived very long after a surgery like that, deep in a tropical rainforest, with no antibiotics and no way to control infection in the modern medical sense. A large open wound like that, under those conditions, would seem almost certain to cause death within days, perhaps weeks. But the strangest part of this story is still to come. That child didn't die. The bones show that the amputated area had completely healed. This person went on to live for another 6 to 9 years after the amputation, and may have survived into adolescence or early adulthood before dying from another cause, unrelated to the old injury. Think about what that really means. A person had just lost the lower part of a leg in a tropical rainforest, tens of thousands of years before any concept of modern medicine existed. They would have had difficulty moving. Difficulty finding food on their own. The wound would have faced an extremely high risk of infection in the humid, bacteria-rich environment of the rainforest. And throughout the recovery period, they almost certainly needed constant help from other people. Someone had to bring them food. Someone had to care for the wound every day. Someone had to protect them from danger while they were almost completely unable to defend themselves. But there is an even bigger question than how they survived. What did the person who performed that amputation know? For someone to survive an amputation, the person performing it had to avoid causing fatal blood loss. Which means they had to understand, at least in practical terms, where on the body they could cut without severing major blood vessels and causing immediate death. They had to handle the tissue carefully enough to give the wound a chance to heal rather than become necrotic. And afterward, the community had to maintain continuous wound care over an extended period of time, not simply treat it once and walk away. This has led many researchers to believe that this community may have possessed significant practical medical and anatomical knowledge. Not, of course, in the modern medical sense of understanding bacteria or sterilization, but clearly far beyond the familiar image many of us still carry in our minds. Prehistoric people only knew how to hunt animals and live in caves. Try to imagine what that process must actually have looked like. First, someone had to make the decision. A decision that certainly wasn't easy, weighing the choice between letting the child suffer from an injury that could lead to a systemic infection and a slow death, or deliberately removing the damaged part of the limb to save the rest of the body. Then they needed a tool sharp enough to cut through tissue and bone decisively, rather than dragging out the process in a way that would cause the patient to slowly lose blood and suffer even more. Then came the most difficult stage. Weeks, perhaps months, of caring for an open wound in the humid environment of a tropical rainforest, where bacteria thrive faster than almost anywhere else on Earth, without any antiseptic in the modern sense. 31,000 years later, archaeologists entered Liang Tibo Cave on Borneo, Indonesia. They excavated a skeleton and saw that the left leg ended in an unusual way. Scientists studied the bones, dated them using radiometric methods, carefully analyzed the healed area, and a story that seemed almost impossible gradually emerged from the remains themselves. Before this discovery, the best-known evidence of a prehistoric amputation was far more recent. a Neolithic skeleton from France dating back only about 7,000 years. The Borno skeleton pushed evidence for this kind of complex surgery back by tens of thousands of years. The discovery was published in Nature in 2022, and it didn't just answer one question. It changed the way the question itself was asked. It was no longer simply, did ancient humans know how to perform surgery? It became, how early did complex human medical knowledge actually begin? And how long have we been underestimating our ancestors? But perhaps the most remarkable part of this entire story isn't that they were able to amputate the leg. It's that the person lived for many years afterward. Because that skeleton is showing us something that care itself can never leave behind as a fossil. Compassion expressed through action. A person who could no longer move normally, living in a small community that constantly had to travel to find food, avoid danger, and survive from season to season, was still fed, protected, and helped long enough to live for many more years instead of being left behind because they had become a burden. This is both a story about ancient medicine and another, much deeper story. A story about how, more than 30,000 years ago, human beings deliberately chose to care for one of the most vulnerable members of their group, even if it meant sharing resources that were already scarce, even if it meant the entire group had to move more slowly, even though there was no guarantee of any reward for that sacrifice. You might think that we'll never know for certain who performed the amputation, what tools they used, or how they controlled the pain during the procedure. And that's true. Many details of this story will remain forever beyond the reach of science, erased by time without leaving a trace. But that absence makes what does remain? The signs of healing on the bone, the evidence that the person survived for years afterward. Even more valuable, because that is almost everything we can know for certain. The next time you think about prehistoric humans, perhaps the image that comes to mind shouldn't be only a man holding a spear, standing outside a cave, growling at wild animals. Perhaps it should be a small community somewhere on the island of Borneo, 31,000 years ago, deciding together that a child who had lost part of their body still deserved to live, to be cared for, to be brought along, until the wound healed and that child's life continued for many more years. That is a decision that no napped stone tool, no spear, could ever prove on its own. It can only be seen through a very small, very quiet mark on a bone that lay buried beneath the ground for 31,000 years. A life that, without that care, would never have had the chance to be told all the way to the present day.